Okay, so instead of me working on the things I need for the next most important application season of my life, I decided to work on a YouTube video about healthcare systems, particularly focusing on the new YAKAP program in the Philippines. And I want to talk about it in context to my history of practicing both primary care and emergency medicine in the Philippines, and now I'm an internal medicine resident in the US. To keep the discussion concise, I want to answer 3 questions. How does the Philippines do primary care before the YAKAP program? What are the problems the YAKAP program meant to solve? And what are the problems the YAKAP program cannot solve? So for the first question, let's start with definitions. Primary care is supposed to be the first point of contact for anyone who wants to seek healthcare. It usually falls into 2 domains. One is you're not sick at all, but you're trying to make sure you don't get sick. So the recommendations are no matter how well you feel, no matter how old you are, you need to be seen by a doctor at least once a year to do preventive screenings. The second domain is basically when you start feeling symptoms and you're getting sick, but you're not sick enough to be hospitalized, you go to your primary care doctor for a checkup. The YAKAP program is basically focused on the prevention side of primary care, and if you don't know what YAKAP means, it's actually a really fun play of words. YAKAP literally means hug in Tagalog, but it's also a shortened form of its bigger name, which is Yaman Kalusugan Program, which is amazing, by the way. You know, Filipinos are really smart. Give your Pinoy friend a hug. I just realized if I keep saying YAKAP program, that means Yaman Kalusugan program, so I'm gonna stop saying that. So before the YAKAP existed, there's no such a thing as preventive care in the Philippines. And I know this because, like I said, I did both primary care and emergency department in the first couple of years as a licensed physician in the Philippines. Filipinos in general do not want to see a doctor or cannot see a doctor unless they're having severe enough symptoms that they end up in the hospital. Oftentimes, their health issues have become so bothersome that they end up in the emergency department instead of the doctor's clinic. There are probably a million reasons why the culture in the Philippines is to not seek healthcare, and I will not try to list any of them because I lied. There's such a thing as preventive care in the Philippines about 5 to 10 years back, and we call it executive checkup. These are basically packages that the private healthcare industry in the Philippines offers to those who can afford preventive care. This includes medical checkups, different labs, different cancer screenings. Sometimes you are actually required to stay in the hospital overnight to prepare for a colonoscopy, and these are hella expensive, like 15,000-20,000 pesos expensive. Median monthly income for a working Filipino level expensive. So these executive packages is only available for the affluent members of Filipino society. After the Universal Healthcare Act in the Philippines was signed back in 2019, we have now mandated the Department of Health of the Philippines to make this executive checkup available to all Filipinos. It took a while and a couple of different iterations, but now we have YAKAP. The program provides free medical consultations to everyone who lives in the Philippines as long as you are a Philhealth member, which is technically is everyone. You are indigent, elderly, OFW, pregnant, a kid, you work, you don't work, you are a Philhealth member automatically, no questions asked. Even if you're a foreigner in the Philippines, as long as you pay contributions to Philhealth, you will be a Philhealth member and you will be able to avail the YAKAP benefits. And as a side note, I say free. It's technically not free as you already paid for it when you're contributing to your PhilHealth and you're paying taxes. And you can argue that those who don't pay taxes or don't pay PhilHealth doesn't necessarily contribute to the funds for this program. Something about intrinsic value of human life. I don't know, not the topic of this video. Let's go back to the YAKAP program. If your YAKAP provider is a government doctor, the primary care checkup is supposed to be free. If you go to a private clinic or a private physician accredited YAKAP provider, they may ask you for a small copay, which is supposed to be enough to deter overutilizers of the system, but is still small enough to make access to the doctor affordable. YAKAP also includes basic laboratories like blood counts, cholesterol, and diabetes tests. They would provide screenings for cancer like lungs, liver, colon, and the reason you need a doctor before you could order all of these blood tests is because we need to assess what you actually need. We could either push these orders earlier or later in your life depending on your risk factors. And lastly, we are not just diagnosing here, we are planning to treat as well. Therefore, the YAKAP provides 20,000 pesos worth of medication per year that includes cholesterol, blood pressure medications, diabetes medications, asthma inhalers, prenatal vitamins, and if you develop an infection, some antibiotics are available as well. You can keep track of these prescriptions through the Gamot app, and Gamot translates to drugs in Tagalog but also is short for guaranteed and accessible for outpatient treatment. And the name is so good. At kung sino ka man nakaisip nito, kudos to you, tunay kang may dugong Makata. If your health status is not too complex, these 20,000 worth of medication is probably enough to pay your entire year's requirements for maintenance medications because drugs in the Philippines are relatively cheap. We have a lot of generic options there, and we don't have private health insurance and pharmacy benefit managers like here in the US who would force the patients to buy branded medications that are crazy expensive. As stated in the Philhealth website, YAKAP program aims to keep every Filipinos healthy and protect them from illnesses. This will definitely remove the financial barriers for the Filipino people who are hesitating to seek healthcare, which is probably majority of the Filipinos out there. The other point I like to discuss is that how government and private clinics get compensated. Because for every patient under the YAKAP program in their panel, they will earn a set amount of compensation for the entire year. So how does this work? Unless you're a private physician who asks for copay, you would have a set amount of compensation regardless of how many times you see a patient for the entire year. A patient that is perfectly healthy, you only see once a year, you earn this much money. A patient who is really complex, you need to see multiple times a month because you are preventing them from getting sick and ending up in the hospital. This is the amount of money you get. And everyone else in between, this is the amount of money you get. It will incentivize the primary care physician to not see you as often because they will not get paid more whenever you see them again, but also incentivize these doctors to keep you as healthy as possible because if your health becomes a problem, it's going to be their problem. And I can get behind that. I want to see my patients healthy and I want their health problem to be my problem to solve. Of course, there are people who will not go to the doctor at all, no matter what happens and no matter what you tell them. And on the other end of the spectrum, there will be patients who will overutilize the quote-unquote free healthcare and they need extra reassurance and tender love and care from healthcare professionals. And I think that's going to be alright because a lot of people are probably in the middle of the bell curve anyways. That's already a lot. And we have one more question. What are the healthcare problems the Philhealth YAKAP cannot solve? A couple of easy answers here. YAKAP is not meant to help Filipinos find specialty care. It's not meant for emergency or hospital-based medicine. We have other Philhealth benefits for that. YAKAP is meant to screen for mental health illnesses, but it's not meant to deliver longitudinal mental health care. No benefits for psychiatry or psychology visits, and no single psychiatric medication on the Philhealth medication covered list. Health issues related to environments, nutrition, elderly care, social determinants of health. These are probably topics for future videos, but like I said, not a problem for YAKAP. As of writing, there are 4,203 YAKAP accredited clinics in the Philippines, catering for 117 million Filipinos. That's 27,000 patients per YAKAP clinic. As we established in my previous videos, the Philippines has a huge physician shortage and distribution problem, and despite training many doctors every year, not a lot of doctors who want to stay in the most rural parts of the country. Older doctors who are already in the provinces may not want to participate in YAKAP program. And I argue that the YAKAP program not only neglects helping those remote rural communities, but might actually worsen their situation. The reason I say this is because one of the requirements for a physician to set up a YAKAP clinic is to have a certified electronic medical record system for reimbursements. And if you live in a province where internet connection and electricity is notoriously unreliable, then you may be out of luck. The workaround for private and government clinics who provide YAKAP care in the provinces is still to see the patient consultations for delivery of care through paper charts, but later on they have to scan and upload these notes to submit online for Philhealth. If you're a small clinic or an older doctor who is not tech savvy enough, this is a lot of work and you may not have the bandwidth to pursue YAKAP accreditation. If you are a fresh graduate, you may not have the financial capacity for the initial investment for the EMR before Philhealth can reimburse your expenses. Doctors still have bills to pay, not just for themselves but also for the clinic's rent, electricity, internet, and salaries for the clinic staff. You as a physician will either not enroll in YAKAP and just ask for out-of-pocket fee per service like majority of physicians before the Universal Healthcare Law, or you would establish your practice in the cities where electricity and internet is more readily accessible, further concentrating the number of healthcare professionals in the already congested mega-metropolitan areas. This electricity and internet issue is also true for the patient side. Not everyone has smartphones to register for the recommended eGov or Gamot app. A 60-year-old farmer who never had a personal computer will be further discouraged to seek healthcare if you ask them to register online first. Lastly, YAKAP is not really meant to solve the structural and systemic corruption plaguing the Philippine healthcare system. Like I said at the beginning of this video, Filipinos are very smart. They would find a way to abuse this system. I have several examples in my mind, but I think this video is already getting too long, and I think these discarding moves by bad actors are beside the point I'm trying to make, which is, I really love the YAKAP program. An ounce of prevention is truly better than a pound of cure, and the way they are implementing it makes a lot of sense in my mind. I personally know a lot of people who would benefit from this program if this existed 10, maybe 20 years ago. Maybe some of the people already gone might still be alive today if they have a YAKAP doctor. There are a lot of deficiencies, of course, and only time will tell if this program is gonna be sustainable. I truly hope YAKAP will make Filipinos' lives better. Give someone a hug. That's all for me. Keep safe out there.
I will be always beside and behind President Marcos, and he's doing a good job para sa ating bansa. Sinabi ko sa kanya na you will always be my friend.
Best describe me?
And why?
Paksiw siguro dahil may asim pa.